Question 1. A pharmacy technician is stocking medications and notices a box of amoxicillin that expired last month. What is the most appropriate action to take? A. Place the expired medication in the regular stock to be used quickly. B. Set the expired medication aside and notify the pharmacist immediately. C. Mark the expiration date with a highlighter to ensure it's used first. D. Donate the expired medication to a local clinic. Answer: B. Set the expired medication aside and notify the pharmacist immediately. This question tests your knowledge of handling expired medications, a key part of maintaining drug quality and patient safety in the pharmacy. The most appropriate action is to immediately remove expired drugs from usable stock to prevent dispensing them and then inform the pharmacist, who is responsible for final decisions regarding disposition. Using expired medication is unsafe and against regulations, and donating expired medication is illegal and dangerous. Proper handling prevents errors and ensures patients receive effective and safe medication. Question 2. Which organization operates a voluntary medication error reporting program called MERP? A. FDA, Food and Drug Administration. B. DEA, Drug Enforcement Administration. C. ISMP, Institute for Safe Medication Practices. D. USP, U.S. Pharmacopoeia. Answer: C. ISMP, Institute for Safe Medication Practices. This question focuses on national organizations involved in medication safety and error reporting, a crucial aspect of quality assurance. The Institute for Safe Medication Practices, ISMP, runs the Medication Error Reporting Program, MERP, a vital system where healthcare professionals can voluntarily report errors to help others learn and prevent similar incidents. The FDA regulates drugs but doesn't operate MERP, the DEA handles controlled substances, and USP sets standards for drug quality and compounding, but none run MERP. Reporting errors helps identify system issues and improve patient safety across healthcare settings. Question 3. Before dispensing a prescription, which step is crucial for a pharmacy technician to help ensure quality and accuracy prior to the pharmacist's final check? A. Counsel the patient on the medication. B. Verify that the patient's insurance covers the medication. C. Compare the label generated by the computer to the original prescription and the medication in the bottle. D. File the original written prescription. Answer: C. Compare the label generated by the computer to the original prescription and the medication in the bottle. This question highlights a critical quality check performed by a technician during the prescription filling process before the pharmacist reviews it. Comparing the printed label information, drug name, strength, dosage form, patient name, instructions, against the original order and confirming it matches the drug product pulled from the shelf is essential for preventing dispensing errors. Counseling is done by the pharmacist, checking insurance is part of the billing process, and filing happens after dispensing, none of which are core quality checks on the product itself at this stage. This verification step catches potential transcription or selection errors early, protecting the patient. Question 4. What is the primary purpose of a root cause analysis, RCA, in a pharmacy setting? A. To punish individuals responsible for an error. B. To identify the underlying reasons why an error or problem occurred to prevent recurrence. C. To quickly close a reported incident. D. To determine the financial cost of a medication error. Answer: B. To identify the underlying reasons why an error or problem occurred to prevent recurrence. This question asks about the goal of root cause analysis, RCA, a fundamental tool in quality assurance. RCA is a systematic process used to investigate an event, like a medication error, by digging deep to find the fundamental flaws in systems or processes that contributed to it, rather than just blaming an individual. The purpose is not punishment, cost calculation, or simply closing the case, but implementing changes to prevent the error from happening again. By understanding the why behind a problem, pharmacies can improve their workflows and policies to enhance patient safety. Question 5. Which of the following is a high-alert medication that requires extra precautions to prevent errors? A. Ibuprofen, Advil, Motrin. B. Amoxicillin. C. Potassium chloride injection. D. Lisinopril. Answer: C. Potassium chloride injection. This question tests your knowledge of high-alert medications, which are drugs that have a higher risk of causing significant patient harm when used in error. While all medications require care, potassium chloride injection is on the ISMP list of high-alert medications because administering it incorrectly, e.g., intravenously undiluted, can be fatal. Ibuprofen, amoxicillin, and lisinopril are common medications with lower inherent risk of catastrophic harm from a single error compared to concentrated electrolytes like potassium chloride. Pharmacies implement special procedures like separation, labeling, and specific protocols to minimize errors with these dangerous medications. Question 6. When preparing a non-sterile compound, accurately measuring or weighing ingredients is critical for quality. Which piece of equipment is most accurate for measuring a liquid volume? A. Beaker. B. Erlenmeyer flask. C. Graduated cylinder. D. Household measuring spoon. Answer: C. Graduated cylinder. This question focuses on the quality aspect of non-sterile compounding, specifically the importance of accurate measurement. While beakers and flasks are used for mixing or holding liquids, they are not designed for precise volume measurement. Household measuring spoons are highly inaccurate for pharmaceutical compounding. A graduated cylinder is calibrated specifically to measure liquid volumes accurately, having clear markings to read the meniscus correctly. Using the proper measuring device ensures the final compound has the correct concentration of ingredients, directly impacting its effectiveness and patient safety. Question 7. What is the primary reason pharmacies must periodically check the expiration dates of medications on their shelves? A. To determine which medications to reorder soon. B. To ensure that dispensed medications are safe and effective. C. To identify medications that are selling slowly. D. To make space for new inventory. Answer: B. To ensure that dispensed medications are safe and effective. This question asks about the main reason for checking drug expiration dates, which is a fundamental quality control process. Medications degrade over time, and using them past their expiration date can mean they have lost potency, might be ineffective, or could have undergone chemical changes making them potentially harmful. Regular checks and removal of expired stock are essential steps to prevent dispensing substandard products and ensure patient safety by guaranteeing that the medications are still safe and work as intended. Question 8. Which action is a key component of a pharmacy's continuous quality improvement (CQI) program? A. Only addressing errors reported by patients. B. Proactively identifying potential risks and implementing improvements before errors occur. C. Conducting quality checks only when required by law. D. Blaming staff members for quality issues. Answer: B. Proactively identifying potential risks and implementing improvements before errors occur. This question tests your understanding of continuous quality improvement (CQI), a core principle in modern pharmacy practice focused on ongoing improvement. A robust CQI program isn't just reactive, addressing errors after they happen, or minimally compliant, doing only what's legally required. It involves actively looking for weaknesses in processes, anticipating where errors might occur, and implementing changes to prevent them. CQI is about improving systems, not placing blame on individuals. Proactive risk assessment is key to building a safer pharmacy environment. Question 9. When a pharmacy receives a drug recall notice, what is the first step the technician should typically take? A. Immediately return all affected stock to the supplier. B. Stop dispensing the affected medication and quarantine existing stock. C. Notify all patients who have received the medication. D. Wait for the pharmacist to handle the entire process. Answer: B. Stop dispensing the affected medication and quarantine existing stock. This question addresses the critical procedure for handling drug recalls, a vital quality and safety measure. The immediate first step upon receiving a recall notice is to prevent any more of the affected product from reaching patients by stopping dispensing and physically separating and labeling the recalled stock, quarantining it. Returning it or notifying patients are subsequent steps depending on the recall class 1, 2, or 3, and pharmacist's direction, but securing the product is the initial priority to prevent further harm. Proper recall procedures protect patients from potentially dangerous or ineffective medications. Question 10. Maintaining accurate inventory records is important for quality assurance because it helps prevent which of the following? A. Overstocking of slow-moving items. B. Difficulty in ordering controlled substances. C. Dispensing errors due to misidentification of products or stock-outs of needed medications. D. Delays in insurance claim processing. Answer: C. Dispensing errors due to misidentification of products or stock-outs of needed medications. This question links inventory management to quality assurance and patient safety. While inventory records help with ordering and managing stock levels, their quality assurance importance lies in ensuring the correct medication is available and locatable. Accurate records prevent situations where a technician might grab the wrong medication because stock is disorganized or looks alike, or where a stockout leads to a delay in therapy or the need to find a less familiar alternative, both of which increase the risk of errors. Good inventory practices support the dispensing process and reduce opportunities for mistakes. Question 11. What is the primary reason for separating look-alike/sound-alike (LASA) medications on the pharmacy shelves? A. To make them easier to find during busy times. B. To prevent medication errors caused by picking the wrong drug. C. To comply with storage temperature requirements. D. To organize them alphabetically. Answer: B. To prevent medication errors caused by picking the wrong drug. This question focuses on a common strategy for preventing a specific type of medication error. LASA medications, like risperidone and ropinirole, look or sound so similar that they are easily confused, leading to dispensing errors. Physically separating them on shelves or using warning labels are crucial quality assurance techniques to reduce the chance a technician or pharmacist will accidentally select the wrong medication during the filling process. This simple step directly enhances patient safety by mitigating a known risk factor for errors. Question 12. When a pharmacy technician receives new medication stock, verifying the shipment against the invoice is a quality assurance step that helps identify: A. Which medications are due to expire soon. B. Discrepancies like incorrect quantities, wrong products, or damaged goods. C. The average cost of the medications received. D. How quickly the medications are expected to sell. Answer: B. Discrepancies like incorrect quantities, wrong products, or damaged goods. This question describes a key quality assurance step in the receiving process in a pharmacy. Checking the incoming shipment against the invoice or purchase order is essential to ensure the pharmacy received exactly what was ordered, in the correct amount, and in good condition. Finding incorrect products, damaged items, or quantity errors prevents these issues from potentially leading to dispensing errors or quality problems down the line. This check ensures the integrity and accuracy of the pharmacy's inventory from the moment it arrives. Question 13. If a pharmacy technician identifies a potential prescription error before the pharmacist's final check, what is the most appropriate action? A. Correct the error themselves without mentioning it. B. Dispense the prescription as is, assuming the pharmacist will catch it. C. Bring the potential error to the immediate attention of the pharmacist. D. leave the prescription unfinished and move to the next task. Answer: C. Bring the potential error to the immediate attention of the pharmacist. This question addresses the technician's crucial role in identifying and reporting potential errors, a core quality responsibility. While technicians are trained to identify discrepancies, they cannot independently correct prescription errors or bypass the pharmacist's final check. If a technician notices anything that seems wrong, like a questionable dose, drug interaction alert, or discrepancy between the prescription and data entry, their duty is to stop and escalate the issue to the pharmacist for review and resolution. This collaborative approach leverages the pharmacist's clinical expertise and is vital for patient safety. Question 14. Proper storage of medications, including maintaining specific temperature ranges, like refrigeration, is essential for quality assurance because it A. helps medications dissolve faster. B. prevents chemical degradation that can affect potency or safety. C. reduces the cost of stocking medications. D. makes medications easier to count. Answer: B. prevents chemical degradation that can affect potency or safety. This question focuses on the quality aspect of drug storage conditions. Medications are manufactured to remain stable and effective when stored within specific temperature ranges: room temperature, refrigeration, freezer. Exposing them to inappropriate temperatures can cause them to break down chemically, losing their effectiveness or even forming harmful byproducts. Monitoring and maintaining proper storage conditions, therefore, is a critical quality control measure to ensure patients receive medications that are safe and potent throughout their shelf life. Question 15. What does the term medication error generally refer to in a pharmacy setting? A. Only errors that cause harm to a patient. B. Any preventable event that may cause or lead to inappropriate medication use or patient harm. C. Mistakes made by pharmacists only. D. Running out of a medication. Answer: B. Any preventable event that may cause or lead to inappropriate medication use or patient harm. This question asks for the definition of a medication error, a central concept in pharmacy quality assurance. A medication error is broadly defined as any preventable incident involving medication that occurs at any stage, from prescribing to administration, whether or not it actually causes harm. The definition includes potential errors, near misses, because identifying and learning from these events is crucial for preventing actual patient harm. Running out of stock or errors made only by pharmacists don't fully encompass the scope of the definition, which covers a wide range of preventable issues across the medication use process. Question 16. Using a laminar airflow workbench, LAFW, correctly during sterile compounding is a critical quality assurance measure primarily intended to A. Keep the technician cool. B. Prevent microbial contamination of the sterile product. C. Make it easier to mix ingredients. D. Reduce the need for pharmacist oversight. Answer: B. Prevent microbial contamination of the sterile product. This question relates to quality assurance in sterile compounding, specifically the purpose of using a LAFW or similar clean air device. These specialized environments provide a flow of HEPA-filtered air that sweeps away particles and microbes, creating a sterile workspace. Their primary purpose is to protect the sterile medication being prepared from contamination by bacteria, fungi, or other microorganisms from the surrounding environment or personnel. Preventing contamination is paramount to ensure the safety and quality of injectable medications. Question 17. Which of the following is an example of a physical safeguard used in pharmacies to prevent errors? A. Using barcodes to verify drug products. B. Regularly training staff on new procedures. C. Implementing a policy for double-checking calculations. D. Conducting patient counseling sessions. Answer: A. Using barcodes to verify drug products. This question asks for an example of a physical safeguard, which refers to a tangible tool or technology used to prevent errors. Barcode scanning systems require the technician or pharmacist to scan the drug product at various points, receiving, filling, dispensing, to confirm it matches the prescription information in the computer system. This technology provides an objective, physical check that helps catch errors like selecting the wrong drug, strength, or form. Training and policies are procedural safeguards, and counseling is a patient interaction, but barcode scanning is a physical barrier to errors. Question 18. When performing a calculation for a medication dose or compound, a key quality assurance step is A. Using a calculator provided by the pharmacy. B. Having another trained person independently verify the calculation. C. Completing the calculation as quickly as possible. D. Estimating the answer before calculating. Answer: B. Having another trained person independently verify the calculation. This question focuses on ensuring accuracy in pharmaceutical calculations, a vital part of quality assurance. Mathematical errors can lead to significant patient harm. A robust quality control measure for critical calculations is the double-check or independent verification by a second trained individual, often another technician for certain tasks, or the pharmacist. This significantly reduces the chance of a calculation error making it to the patient, as a fresh set of eyes can spot mistakes easily missed by the person who did the original calculation. Question 19. Maintaining clear and complete documentation for prescriptions, compounding, and incident reports is essential for quality assurance because it A. Makes pharmacy inspections easier. B. Provides a record for tracking processes, investigating errors, and demonstrating compliance. C. Helps the pharmacy identify its most frequent prescribers. D. Allows for faster dispensing of refills. Answer: B. Provides a record for tracking processes, investigating errors, and demonstrating compliance. This question emphasizes the importance of accurate and thorough documentation in pharmacy quality assurance. Good records serve multiple critical functions. They provide a clear history of dispensing or compounding activities, allow for systematic investigation if an error occurs to understand what happened, and serve as proof that the pharmacy is following established procedures and regulations during inspections. While it may indirectly help with inspections, the primary QA value is in process tracking, error analysis, and demonstrating adherence to quality standards and legal requirements. Question 20. What is a near miss or close call in the context of medication safety? A. A medication error that reached the patient but caused no harm. B. An event where an error was caught before it reached the patient. C. A situation where a patient missed a dose of medication. D. Running low on a particular medication. Answer: B. An event where an error was caught before it reached the patient. This question defines near miss, a crucial concept in proactive quality assurance. A near miss is a potential error that was identified and corrected before it reached the patient and could cause harm. Analyzing near misses is incredibly valuable because they reveal weaknesses in the system that need to be addressed to prevent similar errors from actually happening in the future. Learning from these close calls is a key strategy in continuous quality improvement. Question 21. Which of the following activities must be performed by a pharmacist and cannot be delegated to a technician, due to the need for clinical judgment and final verification? A. Counting pills from a stock bottle. B. Entering prescription information into the computer. C. The final check of a dispensed prescription before it is given to the patient. D. Placing medication in the waiting bin. Answer: C. The final check of a dispensed prescription before it is given to the patient. This question highlights the distinct roles of pharmacists and technicians in the quality control process. While technicians perform many vital tasks, the final check that verifies the accuracy and appropriateness of the dispensed medication against the original prescription and patient profile requires the pharmacist's clinical knowledge and legal responsibility. Counting, data entry, and placing in bins are tasks commonly performed by technicians, but the ultimate responsibility for the safety and accuracy of the dispensed product rests with the pharmacist's final verification. Question 22. Maintaining cleanliness and organization in the pharmacy workspace, especially in compounding areas, is important for quality assurance to A. Make the pharmacy look presentable to customers. B. Prevent contamination and reduce the risk of errors. C. Speed up the dispensing process. D. Reduce the amount of inventory needed. Answer: B. Prevent contamination and reduce the risk of errors. This question addresses the importance of workspace cleanliness and organization as a quality assurance measure. A clean and organized environment is crucial, particularly in areas like compounding where preventing microbial contamination is essential. It also reduces the risk of errors by minimizing clutter that could lead to grabbing the wrong drug or misplacing important documents, and ensures equipment is properly maintained and functioning. Good housekeeping directly contributes to both product quality and patient safety. Question 23. A pharmacy policy requires that all technicians verify patient date of birth and address before dispensing a prescription. This is an example of a quality assurance step designed to prevent A. Insurance billing errors. B. Dispensing the wrong medication to the wrong patient. C. Errors in medication strength. D. Delays in filling the prescription. Answer: B. Dispensing the wrong medication to the wrong patient. This question describes a common quality assurance procedure focused on patient identification. Verifying multiple identifiers like name, date of birth, and address helps confirm that the person receiving the medication is the correct patient for that specific prescription. This step is a critical barrier to prevent dispensing errors where the right medication is given but to the wrong person, which can have serious consequences. It's a simple yet effective way to ensure patient safety at the point of dispensing. Question 24. What is the primary goal of implementing standardized procedures and policies in a pharmacy? A. To limit the amount of work technicians can do. B. To ensure consistency and reduce variability in processes, thereby minimizing errors. C. To make training new employees more difficult. D. To comply with requests from pharmaceutical manufacturers. Answer: B. To ensure consistency and reduce variability in processes, thereby minimizing errors. This question asks about the purpose of standard operating procedures, SOPs, and policies, key elements of a quality assurance program. Standardizing how tasks are performed ensures that everyone follows the same steps consistently, regardless of who is doing the job. This reduces variability in processes, which is a major source of errors and quality issues. Consistent workflows make it easier to identify problems and implement improvements, ultimately leading to a safer and more efficient pharmacy operation. Question 25. Participating in audits or inspections related to controlled substances handling is a quality assurance activity that helps ensure compliance with regulations set by which agency? A. FDA, Food and Drug Administration. B. DEA, Drug Enforcement Administration. C. OSHA, Occupational Safety and Health Administration. D. State Boards of Pharmacy. Answer: B. DEA, Drug Enforcement Administration. This question connects quality assurance activities, specifically audits related to controlled substances, with the relevant regulatory body. The Drug Enforcement Administration, DEA, is the federal agency responsible for enforcing the Controlled Substances Act, which governs the handling, storage, and record-keeping of controlled medications. Participation in DEA audits or inspections helps pharmacies ensure they are meeting these strict legal requirements, which are critical for preventing diversion and ensuring accountability for these high-risk medications. State boards of pharmacy also regulate controlled substances, often working in conjunction with the DEA, but the DEA is the primary federal authority.